you have a cold. That's because all of these four organs are intricately connected. Together, these parts of your body help us experience the world through sight, smell, hearing, and taste. Now, losing one of these senses can have definite negative effects on our health as well as our well-being. That's why it's important that we take care of all of these vital organs. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Viruses and other germs can enter our eyes, ears, nose, and throat if we don't practice proper hygiene or safety. Our guests are here to talk about all of this and more. Let's welcome with us Dr. Glenn Angeles. He's an ophthalmologist at the Health Hub Clinic. Also joining us is Dr. Paulo Angelo Catindig, who is an ENT head and neck surgeon, rhinologist from the Bulacan Medical Center, as well as the Makati Medical Center. Pag-usapan natin ang ating mga mata. Is it very common ngayon na pandemic? Gaano ka-risky ang ating mga mata when it comes to being infected with COVID-19?
So with regards to COVID-19 and the eyes, we've been seeing COVID positive patients on patients with sore eyes. For example, a patient consults us with sore eyes. Usually, we ask kung mayroon siyang ibang symptoms like cough, colds, fever. Then, if they usually have their test done, usually it comes out positive.
Dr. Glenn, ang notion ng marami is the COVID virus is in the air and dumadapo sa mata natin. Kaya tayo nag-face shield, kaya kailangan protektahan ng eyes. Is this more the case where the virus enters our eye through the air, or is it more of a contamination type of inoculation?
More on contamination type, more on contact, for example. Because for conjunctivitis, usually makatayan, diba? Itchy. When patients rub their eyes, usually what happens is they touch another object or they touch a table, then someone touched the table, then they rub their eyes. So yung mga nagfe-facial, technically it's helpful in a way because it avoids us from touching our eyes. Kumbaga, yung mga naka-glasses, okay sila because napoprotektahan sila.
Dr. Glenn, you also mentioned a very important one, ang sore eyes, conjunctivitis. Pag hindi naman COVID-19 ang cause ng conjunctivitis, how is this normally treated? A lot of Filipinos like to avail of the over-the-counter vasoconstrictors, yung mga eye drops para pampawala ng redness. Is this the right medication to use for sore eyes?
For sore eyes, usually the symptoms yan kumbaga, it's viral, so it's self-limiting. Usually it will resolve after 1 to 2 weeks. I ask my patient to do bed rest so they cannot go to work because nakakahawa talaga siya. So they can use supportive therapy like mga artificial tears para sa parang supportive management lang. They can put cold compress. Importante dyan is frequent hand washing and proper hygiene.
Now let's talk about corrective lenses versus contact lenses. Is one better than the other, Dr. Glenn?
Actually, it will really depend. No? For glasses, at least it's a protection. For contact lens, okay lang rin siya. Both are okay to correct your error of refraction.
Let's talk about the extra added care that people should be doing if ever they choose to use contact lenses, because this can also be a vehicle for a lot of germs, for a lot of viruses kapag hindi ito naalagaan. What's the proper contact lens care, Dr. Glenn?
So for contact lens care, definitely you need to remove it every day. You need to clean it. And with contact lens naman kasi, ang magiging concern lang dyan is how you clean it and how you properly store it. Kasi contact lens, may chance. Also, you need to keep on putting parang artificial tears to lubricate the contact lens, or else baka mag-dry and pagtanggal mo, magkaroon ng corneal abrasions or superficial punctate keratitis, magkasugat, then that's a cause of concern.
Okay. Let's talk about, since pandemic, maraming mga tao, Dr. Glenn, ang work from home. They're using their laptops, computers for numerous meetings and whatnot. And ang nangyayari dito, ang common is ang eye strain. And some studies are pointing that what adds to this eye strain is the blue light emitted by a lot of gadgets. How true is this, Dr. Glenn? What should our viewers do? Kasi unavoidable kung work from home that they're in front of their laptop or gadgets.
Blue light din naman kasi when you go out, sun, it's helpful then. It makes us alert. more ano no. But for gadgets, more on eye strain kasi siya. So for eye strain, what people can do, usually they have Zoom meetings, they have meetings online, they're playing with their gadgets, YouTube, mga ganon. What they can do is they can rest their eyes. So papasok ulit tayo dun sa 2020, no? Every 20 minutes, you rest for 20 seconds by looking 20 feet away.
Now let's also talk about something that may be common during this time, ang hordeolum, also known as a sty, or in Tagalog, kulite. So how does this happen, Dr. Glenn? What are the risk factors para magkaroon ng kulite sa mata? How serious of a condition is this? Pwede ba itong gamutin sa bahay? Because a lot of people now are wary again in going to the hospital for treatment.
Actually, marami rin kulite. So for kulite, there are pores dun sa mata natin, sa pilik mata natin, na gets blocked, then gets infected. So para siyang pimple pero sa mata. No? So for treatment naman nun, usually we give antibiotic ointments and ask the patients to do warm compress, and if ever, we can also do bleed hygiene for the patients. It really depends eh. Pag malaki na, sobrang laki, we also give them, parang if there's another, parang nagkakaroon ng preseptal cellulitis or yung infection na mas grabe, we give oral antibiotics then.
So marami tayong napag-usapan with regards to our eye, and we will continue to talk about that later on the show. But just as important is our eyes, our ears, nose, and throat are also vital for our everyday care. When we return, we'll talk about how to properly care for them. We're your connection to healthcare. You're watching MedTalk Health Talk. Proper ear care is more than just hygiene. Safety from noise and injury is important as well. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. We're together in health. Learning how to properly clean the ears, all of these are good when it comes to our care of our ears. But let's first talk about hygiene. Cotton buds, any sharp-pointed object should not be used to clean the ears, as they may injure not just the ear canal, but the vital organs further down, like your eardrum. From top to bottom, let's start first with the ears. Paano ba ang tamang paraan ng paglinis ng tenga?
Wax is a very protective part of our body that protects us from infection, gives moisture to our ear canal, kaya hindi ko talaga rin ina-advise that we clean it every day. What I usually advise to my patients is you can use, after taking a bath, you can use your towel, just clean the outer part of your ear, wipe it clean, then basically that's it. But syempre mga Filipinos, they're very malinis, hygienic. So may mga pasyente pa rin that would really ask, Doc, how often can we use cotton buds? So usually I would tell them, sige, you can use your cotton buds at least minimum of once a week, but just the outer ear canal. Kasi usually naman yung wax mo is being produced at the outer part of the ear. The tendency kasi if we push it masyado sa loob, papasok masyado yung wax, then it would cause hearing problem naman sa patients.
Let's talk about hearing loss naman. This is something that is very prevalent now, especially habang tumatanda. It is not uncommon na humina ang pandinig ng mga seniors natin o mga loved ones natin na mga nakatatanda. But a lot of people may not be aware of this. So what are some of the red flags kaya, Dr. Paulo? What are some of the cues that a hearing exam may be needed for hearing loss?
So usually for my patients, ang mas magandang tanungin dyan is yung kasama actually, no? Not really the patient, because the patient themselves will not notice na mahina yung pandinig nila. Ang makakapuna nun is yung mga kasama sa bahay. The relatives or yung companion would tell us na, Dok, yung pong pasyenteng yan, lagi po niyang pinapaulit-ulit yung sinasabi namin, or kunyari, tatanungin namin, iba yung sinasabi, iba sinasagot, or they would tell us, ulitin mo nga yung sinasabi mo. One. Number two, volume ng TV. Minsan napakalakas na ng volume ng TV na akala ng patient normal na yon. So better ask the companion rather than the patient kasi patients would not notice it eh. Mas madalas the companion will notice na, hina pala yung pandinig. Talagang tingi ka.
Now let's move on to the nose. Especially now, a lot of people are scared of COVID. Anything that they feel, any disturbance in their nose, nasal congestion, rhinitis, or yung runny nose, they're very anxious. How can our viewers spot whether this is caused by an allergic entity or this could probably be COVID?
The problem right now is that we really cannot differentiate whether it is allergic or viral infection or COVID. So for now, because of the current surge of COVID infection, what I would usually recommend my patient is still to get tested. Mm-hmm. That is the number one rule when it comes kapag runny nose. Kasi the only way that you can differentiate if it is viral or COVID versus non-COVID is through testing. Mahirap talagang makipagsapalaran. Though by history alone, some patients would tell me na, Doc, talagang even before COVID, I have runny nose already, frequent sneezing and itchiness. Now, syempre, aside from nasal congestion alone, patient would also complain of fever, cough. Yun, syempre, medyo magdodoble ingat ka na,
Right,
lalo na
true.
kapag ka ganon.
Anong first aid ng pagdudugo ng ilong or ang epistaxis? Madalas mangyari ito, especially sa mga bata.
So usually pagka may mga epistaxis or balingoy-ngoy in Tagalog, no, what I usually tell my patients is number one, do not panic. Number two, try kasi yung iba, ang ginagawa natin, we try to tilt our heads up. No? So sinasabi ko, wag niyong itataas or titingala yung ulo. Try to bring them down, then just put digital pressure dun sa ilong. Try to press it at least around 5 to 10 minutes until yung bleeding would stop. If there is persistence of bleeding at lumalabas na pati sa bibig, just let them spit it out. Then you can put cold compress, ice compress, either sa head part or dito sa may batok na part. That is okay also.
Aside from that, also from the nose, let's go further down sa throat. Minsan kasama ng mga nasal symptoms yan ay ang sore throat or masakit lumunok. That's also another cause for anxiety when it comes to COVID. Dr. Paolo, when it comes to these changes, explain to our viewers what they should do if they lose their voice. What disease entities could these lead to?
There are some cases also that I had na they would complain of hoarseness or napaos ang boses nila. And tawag natin dyan is laryngitis. No? But for shorter duration, what we call is acute laryngitis. And for those cases, ang importante is voice rest. No? If magkaroon ka ng paos ng boses, pahinga lang. Talagang ipahinga yung boses and then try to hydrate. Drink a lot of fluids. Then try to consult if there is persistence of this hoarseness for more than a week time accompanied by soreness, pananakit na ng lalamunan, then please try to consult your healthcare professional.
When it comes to choking naman, anong magandang first aid?
Number one, syempre yung response ng patient. No? There's what we call Heimlich maneuver. No? But ang ginagawa natin, kunyari biglang na-choke yung pasyente, you pupunta kayo sa likod ng pasyente, then you wrap around dun sa ibabaw ng tiyan, above the belly, yung belly button, then you put your fist, ibilog din sa likod ito, then try to push it up towards the chest area until maisuka ng pasyente or mailabas niya yung foreign object doon sa bibig.
There are several eye, ear, nose, and throat conditions that affect us Filipinos. When we return, we'll talk about good preventive measures for a good overall health because your health is our mission. This is MedTalk Health Talk. We'll be right back. Physicians always follow the rule that prevention is always better than cure. Now, for our eyes, our ears, nose, and throat, having a regular checkup is always good to do. Now, the question is, how often should we do this and where can we go? For an eye exam, Dr. Glenn, gaano kadalas ba dapat ito? Should people go to their ophthalmologist kapag meron lang silang nararamdaman, or pwede ba itong something regular na ginagawa? And if so, how often?
Usually, we advise our patients at least an annual ophtha consult, at least once a year, no? For kids na kailangan magpalit ng eyeglasses, usually every 6 months, we ask them to come to us. But definitely, if may nararamdaman sila, they need to go to an ophthalmologist para makapag-consulta sila ng mas maayos.
Now, Dr. Paolo, when it comes to ENT, ear, nose, throat, regular exams, gaano kadalas ang magandang interval nito? Especially when it gets a parang full battery of tests with regards to our ears, our nose, and our throat.
Okay, there's no really specific time frame on when to really check it. But ideally for adults, ang tawag natin doon pag matatanda na, na humihina ang pandinig is what we call presbycusis. And I usually tell them that it would really happen because parang ng tao, parang sasakyan, as we grow old, may mga parte rin talaga ng katawan na pumapalya, and that's part of the ears. Some patients also who are exposed to loud noises, like patients who are working as seafarers, na exposed din talaga sa loud noises, or those who are ng mga blue-collar jobs, yung mga nagdidrill, yung mga road works. Those are those patients na mas maganda talagang mabantayan yung hearing problems nila or yung hearing test nila. No? Now, in terms of hearing testing, wala rin talagang specific guidelines on when to do it. Usually, when patients would come to our clinics, they would complain of these hearing problems, and then that's the time we would recommend doing the hearing test. Now, once the hearing test would show that there is really hearing problem or decrease in hearing, doon tayo mag-monitor probably. At least ako, I would tell them we monitor it annually for those patients na early onset at may mga trabaho. But for those older patients who would require hearing aids already, then probably every 2 to 3 years of hearing test monitoring for it.
Now, Dr. Glenn, pagdating naman sa mata, anong mga pagkain ang known na masustansya para sa mata, or vitamins for that matter?
So usually, we tell our patients to eat green leafy vegetables, more on green leafy vegetables lang naman. And we advise them na have their regular ophtha consult talaga. So we know if there are any concerns or problems, because like for error of refraction, sometimes hindi naman nila nakikita yan eh. So minsan yung mga bata, lalo na for kids, magko-complain na lang yan, malabo vision niya or sa school. Right now, because of the Zoom, mas less nilang complain yung hindi nila makita yung blackboard, di ba? So usually for now, we advise them pag nagko-complain yung bata or nag-squint yung bata to look at objects, then dalhin nila sa ophtha para mabigyan natin ng tamang reseta for the glasses.
Now, this discussion was indeed very helpful, and I'm sure our viewers learned a lot from our guests. So thank you very much, ophthalmologist Dr. Glenn Angeles and ENT head and neck surgeon Dr. Paolo Catindig. Maraming salamat sa inyo. Each of our senses play an important role by making our lives amazing when they work together. So it's important that we protect these organs. Before making any drastic changes to your health or undergoing treatment, always make sure to consult your doctor first. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk.